There is almost always a risk when you have a procedure done at the hospital. In the case of a heart procedure, stroke is a risk. But a new device is being tested in clinical trials to prevent a stroke, thanks to a doctor here in Asheville. James Belserek says last year he was having some issues with his breathing.
The symptoms are just typical fatigue and can't get your breath, extreme fatigue for me because it had gotten to the serious level.
Mr. Balsarek?
His doctor said it was an issue with his aortic valve. This top picture shows a healthy valve. As we age, it tends to narrow, as shown in the bottom picture. This is called stenosis. His doctor recommended a transcatheter aortic valve replacement.
So when we do that, we typically go from the leg artery. And so we access the leg artery. We do not have to do open heart surgery for that. We advance the valve up to the heart and implant it.
This procedure widens the opening of that valve, but in the process, sometimes calcium that is built up around the valve is released, and that can travel to the brain, causing a stroke.
That risk, thankfully, is low. So for a major stroke is about 1.5%. But for any kind of stroke, that risk is about 4 to 5% for patients.
And Dr. Shanae says even if it's small, it still happens to a certain number of patients. So his colleague, cardiac surgeon Mark Groh, developed a device called the M-Stop. This device acts as a filter, covering the back end at the catheter, catching any calcium as it's released.
We did 10 patients here at Mission Hospital, the first 10 in the world, so this has never been done previously.
Belserek was the first patient to test it out. So you didn't have a stroke during the procedure?
I did not have a stroke, no.
Nor did any of the other patients.
0 strokes. The clinical data was very promising. We're very excited about that.
This is a small sample size, so more clinical trials are needed before this hits the market. But Belserek is happy with the outcome.
Before going to the hospital, it was a good experience.
Now, the next phase is what they call a pivotal study, so they hope to expand this clinical trial to 25 centers across the country. This would likely include more than 1,000 patients.